out here in the rain. We have a booth. It's farmer's market, down rigging weekend. We have flyers with the 800 number. And to call Nancy Cott, Peter Francho. We're giving away ribbons to anyone that loans to support us, candy for the kids, and any questions anybody has, we're here to answer them. We're on a countdown, crunch time. I don't think we're going to find out anything on the 4th. I think we're going to be standing this time next year.
Thank you very much.
Thank you.
And that's where the money's going. Not there, it's going to go there.
So what do you think about the student and the community involvement?
I think it's been wonderful. By and large, we have a lot of community support. The support from the Washington College students has been tremendous. You know, they're out there rallying for us. We are very grateful.
My grandma in the 1960s up until 2000 really led a way for patients that were mentally retarded. I would encourage anyone who believes in human rights issues to get absolutely involved. It comes down to the language of the heart. Just if people need a place to stay, they will be displaced from their families, friends, and it's all about rehabilitating people and getting them absolutely back into the community. And if they're lacking the community support and the family support, they won't get it just through the institutions. It's a threefold that we need, absolutely.
Hi, Jerry Inglesby here. I'm on the Board of Trustees at Upper Shore. I'm quite pleased that the governor has put off the deadline for making a decision until November 18th. We're ever more hopeful that all our employees and the patients will be spared the ignominy of not having a place to go. Thanks very much.
We're out here trying to keep Upper Shore open for our patients. I've been here 27 years and I think we do a good job. And I think families have told us we do a good job. And our patients get good care here, and they need a hospital to go sometimes to be taken care of. Not just outpatient services or private 5 to 7 days.
I'm here because it's important as an employee here and as a citizen of this area to voice our opinions regarding keeping this hospital open. We give good care to professionals. We also support the tax base. We also pay taxes. And my concern is that individuals who need our care would be put out into the private hospital domain for 5 days of medical assistance care, and then they get kicked out. They go off their meds and they get worse and worse and worse. And then they come back to the 5-day care in the private hospital. Then we end up seeing the failures of that system. If we're not here, where are they going to go? We've been a hub for educating many individuals in this community and in our educational institutions as well. We've had psychiatric residents come here for training in psychology and psychiatry and social work and get good training there. College students coming on over here and getting a good experience. Excellent place for training.
Anytime I have an opportunity to speak to keep Upper Shore open, I would like to be able to do that. I feel that deeply about it. I've been here 20 years working with these clients, and a lot of them the whole 20 years I've been here. And I know the need is here. It isn't going to go away. If we go away, it's still going to be here, but the difference is we're not going to have anyone here to care for our patients.
Upper Shore supports people from all over Maryland dealing with mental health sicknesses and addictions too. As a part of the recovery community in Chestertown, I've also had the opportunity to witness some of these people firsthand in their lives. You know, and seeing what it's done for them, the joy and the peace that it's brought them.